Hi ladies and gentlemen, my name is Dr. Julio Navoa. Today I continue my series on medical gaslighting, and I wanted to talk about something that I see or read about almost every day, and that has to do with textured implants and breast implant associated anaplastic large cell lymphoma, or BIA ALCL. I'm just going to say ALCL for short. I know that many people that are concerned about breast implants have already heard about this particular subject, but in terms of medical gaslighting, I wanted to talk specifically about its history. So, the best way to understand what the travesty is related to this particular subject is this information. No matter what you hear from your cosmetic surgeon or your plastic surgeon, every single type of breast implant is associated with a foreign body reaction. The severity of that foreign body reaction is dependent on a number of factors, but the most important factor has to do with the patient's own body response to the foreign body, to the implant. More importantly, we understand that every single patient has some type of foreign body reaction to their implants, because what is the most natural foreign body reaction? That is the formation of a capsule, a membranous material that the body forms around each implant that a patient has. In the case of breast implants, it is a capsule which is very similar to size and shape of the implant itself, but it does have stretching components to it that allows for the movement of the natural implant that's inside of this capsule. This is the most common and the most benign foreign body reaction associated with breast implants. However, the most common foreign body reaction that is not benign is the capsular contracture, which means that the body realizes that that implant is a foreign body and therefore tries to squeeze that implant down or tries to get rid of that implant. And in having that foreign body reaction, the capsule that's around the implant gets thicker, less elastic, and actually starts to contract down around the implant. That's why you have the firmness of an implant that's subject to capsular contracture, along with its elevation of the implant. And in the worst case scenarios, the actual physical expulsion or extrusion of the implant through any part of the weakest part of the particular breast tissue. So you can actually, if you leave it in long enough and you have a capsular contracture, an implant may actually come through the skin itself, pop right out of the skin. So in order to try to avoid the formation of a capsular contracture, Allergan and many other breast implant companies tried to design an implant that would be less sensitive to the body and therefore allow for a lower risk of a capsular contracture. And what they found was that if you make the implant, rather than smooth on the outside, if you make it more textured, that the body responded by not forming a capsule around it, or less likely to form a capsular contracture around it. But the drawback to that was that the body constantly is trying to understand this new textured material, which is made out of silicone itself, but this new textured material, and therefore it activated the immune system to a greater extent, not by the formation of the capsule itself, but activated the immune system to a greater extent, which kind of wreaked havoc on certain immune cells, the T cells specifically. So in response to all of that, over time, there was a mutation of the cells that were responding to this textured material, and that mutation can eventually lead to lymphoma, a lymphoma cancer, and it's not actually breast tissue, but the lymphocytes associated with the immune response that become mutated and can eventually lead to lymphoma cancer. Now, this takes a long time, and that's one of the reasons why it took so long to figure out that it was actually a problem. But here's the catch as far as medical gaslighting is concerned. We've known for a while, for a great while, that it was a problem or a potential problem. Yet, doctors still place textured implants in the body without telling patients that a problem may exist with ALCL, or cancer of a lymphoma cancer associated with textured implants. So for the longest time, textured implants stayed on the market. And this is the key to the medical gaslighting history of textured implants. Now that you have an idea of why textured implants cause this very unique and specific foreign body reaction leading to lymphoma cancer, let's talk about the history. Based on a little bit of research in the publications, I found that the first case that may have been associated with lymphoma and silicone implants dates back to 1997. After that, the first reported case to the FDA occurred in 2011. And in about the same time, there is a plastic surgery profile registry where information related to issues related to implants can be documented. And the profile system started documenting the issues with textured implants as early as 2011. Now, here's where things sped up a bit and where it got really interesting and really important as far as responsibility of notifying the general public. And that was specifically in one of the most in-depth publications related to ALCL occurred in 2015. But it wasn't until 2017 that a very, very important study was done, and that came out of Australia and New Zealand. And why that's important is because Australia and New Zealand, as far as breast implants are concerned, were able to document and have a very, very specific and in-depth registry of all patients that got breast implants. So unlike what we see in the United States and many other countries where their registries are not very good, the ones in Australia and in New Zealand are very, very good. Almost down to every person that got breast implants were documented in the registry. And because of this captured audience, the researchers were able to come up with a very, very specific conclusion based on textured implants. And what they found was that the Allergan BioCell series, which is of a high-grade silicone material, as far as the texture is concerned, was found to have a risk of developing ALCL of approximately 1 in 2,000 to 1 in 3,000. Polyurethane implants had a slightly lower risk, and then the ones in the general smooth implants, for example, were very, very close to the general public of developing ALCL, which was about 1 in 30,000. But with this very important study that came out of Australia and New Zealand, the Therapeutic Goods Administration, which is the equivalent to the FDA in Australia, flagged textured implants, and in 2019 advocated for a recall of textured implants, specifically the Allergan series BioCell. Now, here's the deal. We knew about the issues with textured implants dating back as early as 1997, and specifically as early as 2011. Okay, so all of these studies came out related to it, and then in 2017, the Australian study came out. It took 2 years for the TGA to recall implants Allergan series in Australia and New Zealand. But nevertheless, that was kind of short depending on when you look at that great publication. And so in 2019, there was a recall of the implants in Australia and New Zealand. Now get this. It took an entire year later for the FDA to request Allergan to do a voluntary recall of its textured implants, which, of course, Allergan did. Being responsible, Allergan did that. Okay? But it took another year for that to happen, and since that time, there's still patients that may not know that they have textured implants in place. The medical gaslighting was a combination of failures of the FDA and also of plastic surgeons and cosmetic surgeons in general, and specifically a failure of notification from the profile registry that they were doing as early as 2011. That's the medical gaslighting component, because rather than come up with the description and concern dating back as early as 2011, there was very little discussion about this potential risk of lymphoma cancer, even though the data suggested that there was a significant link associated with textured implants, especially of the Allergan series, BioCell. So whose fault is that? Was there medical gaslighting? Of course, absolutely there was medical gaslighting on the part of a combination of the FDA, and maybe Allergan should be included in this, but definitely the plastic surgeons, because the information that you read that's published takes years to get that information out there, to get the information. But once there's a publication, it pretty much gets passed by word of mouth exactly whether something is good or bad. And yes, the rumors related to ALCL and textured implants were started as early as 2011. And then definitely the cat was out of the bag when Australia published its study in 2019, and definitely when the TGA, equivalent to the FDA in Australia, recalled textured implants in Australia. But look how long it took for it to be voluntarily recalled in the United States. That's the medical gaslighting. Now, is the risk significant? When you compare 1 in 2,000 to 1 in 30,000, yes, that's significant. Luckily, it takes a very long time for this particular type of cancer to progress, usually about 10 years. So if there are patients that still have textured implants in their bodies, they still have an opportunity to remove those implants. But get this, Allergan will pay for the will pay for the replacement of implants, but as of now, do not pay for the removal of the implants. Okay, so they're helping, but not paying for the entire cost of it. Now, how you feel about that, that's up to you to decide. But the fact of the matter is that there was medical gaslighting, even to a higher level, because definitely by 2019, plastic surgeons and cosmetic surgeons knew about this problem, but it wasn't included in the informed consent. Wasn't included in the informed consent until November 2021, where it's now included in the patient checklist before you get saline or silicone implants, even though ALCL is associated with textured high-grade implants, most commonly with the Allergan series. So that's medical gaslighting for today. I hope that helps out. Again, as I keep saying, never take anything that your doctor tells you for granted. Look up the information, because your best advocate as far as informed consent is concerned is you, yourself. Thanks so much for watching. Take care.